Number 5, the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Associate Minister of Health. What advice, if any, has he received on the financial viability of the home and community support sector for older New Zealanders?
Speaker.
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, I've received a range of advice, including advice that this government, despite financial constraints, has continued to increase funding for home and community support services for older New Zealanders from $271 million in 2008 to $356 million in 2015. That's more than 30% increase in funding for this sector in the past 7 years.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
What is his response to the report provided to the Minister of Health from the Home and Community Health Association just before the budget, which outlined the instability of the home care sector, its critically challenged financial viability, workforce retention problems and increasing demand for service?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, I say to that member that, as I said in the answer to the first question, funding has increased over 7 years. In fact, in the last year alone, it has gone up 4.4%, from $341 million to $356 million. I also add, Mr Speaker, that we are conducting workshops to look at revising the health of older people's strategy. And during those workshops, a number of issues came up addressing what the member has just spoken about, including making the system truly people-centred, making smarter investment approach to healthy ageing, as well as reducing rigidities and increasing flexibility in service and business models.
Supplementary question.
Supplementary question, Honourable Annette King.
Will DHBs be required to pass on to providers of home care sufficient funding to cover the recent minimum wage increase in light of the said report, which states prices have not kept up with increases over the past 7 years and some organisations are now in multiple years of loss?
The Honourable Pesata Sam Lotu-Iiga.
Well, I reject the assertion that member made about the last 7 years. But what I will say is that, as the member knows, the budget outlined the additional allocation of $400 million per year in Budget 2016. The DHBs are working on the allocation of that funding through their DHB plans. That member knows that.
Point of order, Mr Speaker.
Point of order, the Honourable.
I seek leave to table the Home and Community Health Association report, which is not publicly available, entitled Economic Instability of the Home Support Sector, dated April 2016.
Leave is sought to table that particular report of the Home and Community Centre. Is there any objection to that report being tabled? There is not.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
How much funding has been provided to DHBs in Budget 2016 to implement the second part of the in-between travel agreement for providers and carers of home care for older New Zealanders?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, that member knows that the government has agreed to pay $38 million for in-between travel, and that started in April of this year. In terms of Part B, it continues to be worked on.
Supplementary question,
Supplementary question, Honourable Annette King.
When he read the report on changes to home and community support services from Capital and Coast and Hutt Valley DHB, was he satisfied that there would be no adverse effects on the 700 older people who will be transitioned out of their home care services in an effort to reduce costs?
The Honourable Pesata Sam Lotu-Iiga.
Well, Mr Speaker, again, I challenge the veracity of that member's assumptions around those 700 people.
Point of order, the Honourable Annette
Mr
King.
Speaker, I seek leave to table a report from Capital and Coast and Hutt Valley District Health Board, which is not available, Home and Community Support Services. And the pages I am tabling reflect what I had in my question.
Order. I'll put the leave sought to table that particular report from Capital and Coast Health. Is there any objection to it being tabled? There is none.
Supplementary
tabled.
question, Mr Speaker.
Supplementary question, the Honourable Annette King.
What work is currently underway in his portfolio to look at means test as well as asset test of older New Zealanders needing home and community support services, something that doesn't happen currently?
The Honourable Pestata Sam Lotu-Iiga.
Mr Speaker, as I've already said earlier, there is work being done on the health of older persons strategy that does involve looking at the increasing flexibility and responsiveness of funding streams. It also looks at the improving the integration and collaboration within the health sector.
That's a yes.
Question number 6, Ian McKellar.